When I look in the mirror, I see a hideous beast. It makes me ashamed, sad to look this way.
That is a lot of skin. But the good news is it can be removed.
I wish I could just get away from this reminder of being the way that I was.
There's so many people nowadays who are able to lose massive amounts of weight, either from surgery to medications to old-fashioned diet and exercise. But the problem is this often leaves people with all of this excess skin. This excess skin can occur on all parts of the body, from the face to the arms, to the breast, to the tummy, to the thighs, to even the calves.
I was 13 when I reached 200 pounds. And I kept eating as I got older. At my heaviest, I weighed around 520 pounds.
The speed at which you lose weight may play an impact on how much excess skin you have. There is a belief, although I don't think it's ever been proven, that the slower that you lose the weight, the less excess skin you may have afterwards. Essentially, you give your body time for that skin to retract and for it to kind of shrink on its own. The problem is when you're that large, over 500 pounds, no matter how slow you lose that weight, there's so much excess skin that it's going to be left over, and it leaves a person like her feeling like a small person in this envelope of a big body.
And my marriage fell apart because he became resentful. So I had to rely on my daughter daily for help.
One of the problems when somebody weighs as much as she did is that often people are not able to perform their activities of daily living, or their ADLs. And these are simple things like cooking and cleaning for yourself, washing yourself, going to the store to buy groceries, and other things that a quote-unquote normal person is able to do on their own. When somebody is morbidly obese, sometimes they are unable to perform these activities and they rely on somebody else to do it for them. This can create a lot of difficulties in relationships, as you could imagine.
I no longer wanted to be a drain on my children's lives. So I decided to have gastric sleeve surgery. And I honestly thought that I wasn't going to lose weight, but I did.
There are two commonly performed surgeries to lose weight nowadays. There is the gastric bypass, which has been around honestly for over 20 years, where the vast majority of the stomach is literally removed, leaving just a golf ball sized portion left. On top of that, the stomach is actually rerouted around a portion of the intestines to reduce the amount of absorption of the food that occurs. The second operation is a gastric sleeve. In this operation, a portion of the stomach is removed, not as much as with a gastric bypass, but it leaves the stomach about the size of a banana. This does not reroute the intestines, unlike the gastric bypass, and is considered a bit of a less invasive procedure. This is what she had, and it's great that it really worked for her.
It wasn't long before I started noticing all the extra skin, and it felt like all the hard work I'd done was for nothing. My stomach, it's just horrible. It sits out here.
Usually the first part of the body that patients complain about and want to treat after losing a lot of weight is the stomach. And this operation is called an abdominoplasty or a tummy tuck. The most common person who undergoes a tummy tuck is a woman who's had a couple of children. And those multiple pregnancies may have stretched the tummy out so much that she has excess skin that is removed during this operation. People who've lost large amounts of weight often also undergo a tummy tuck, but those tummy tucks can be much more extensive. They can be lower body lifts, where the entire lower body is basically lifted up. They can be fleur-de-lis tummy tucks, where not only is skin removed and pulled downward, but it's also pulled inward. Or they can be circumferential, where skin is removed all the way around the body, kind of like a donut of skin being removed. The thing to keep in mind with any of these operations is that they create lengthy, permanent scars.
I can see my muscle definition, but nobody else sees that because all they can see is the skin.
So this is excess skin of the upper arms that we see oftentimes in people who've lost a lot of weight. And the way to remove that skin is called a brachioplasty. This is a surgery that creates an incision basically from the armpit all the way to the elbow, and that excess skin is cut out and typically liposuction performed of any additional fat in that area. The problem with that operation, like with the tummy tuck, is you get a lengthy scar. And in this operation, the scar literally goes from your armpit all the way to the elbow and sometimes farther.
I feel like I've gone from one insecurity to another, and this one's worse. Because inside, I'm sad, I'm depressed, If you see me smiling, it's not true.
In addition to just having to deal with all that excess skin, it's very common that people who have skin folds like this can get excoriations and dermatitis underneath and between those skin folds. One thing that can help when that type of thing happens is to use anti-monkey butt powder. Yes, anti-monkey butt. This is kind of like baby powder in that it basically, you put it into those folds and it prevents chafing. A lot of people use this actually in the summertime if they're going to the beach. But that's only a temporary improvement. The real solution to all this excess skin is to cut it out.
I lost 320 pounds by having the vertical sleeve gastrectomy.
And how much you weigh now?
I fluctuate between 175 and 185.
That is a large amount of weight to lose. When we see massive weight loss patients as plastic surgeons, oftentimes I see people who've lost maybe 70, 80 pounds, but to lose as much as she had, that is something that I do not see very often, and it really can create a very, very challenging operation. In these types of situations, patients like her need to see a massive weight loss plastic surgery specialist because general plastic surgeons probably aren't going to be experienced enough in these types of advanced techniques to treat a patient like her.
All right, I think you're going to be a good candidate for skin surgery. So we're going to approve you for that. The first operation will be do the thigh lift and upper body lift.
You cannot do all of the operations at one time. A thigh lift and an upper body lift essentially is taking the entire lower body and lifting it up, removing the excess skin. That typically can create scars that go all the way around the torso, as well as scars on the inside of the thighs. This operation can take 6 hours or longer. Patients can lose a lot of blood, and there's a risk of blood clots after the operation. So you want to make sure if you're going to have a surgery like this that you've got a really, really good plastic surgeon operating on you.
Then we can do the arms and tummy tuck in the second operation.
I tend to limit my surgeries to about 5 to 5.5 hours. And when you think about it, doing an operation is a very physical activity. And can you think about doing a physical activity for 5 to 5.5 hours, literally without taking a break? That is what we do in surgery. And on those days, I can be pretty shot afterwards. That being said, there are surgeons who will do 8 to 10-hour operations. Not my thing. I think that the risk of blood clots and other complications, including anesthesia-related complications, continues to go up the longer a patient's under anesthesia, but that doesn't stop some plastic surgeons from operating much, much longer than I do and taking that risk with the patient.
The surgery will not only give her a better outlook on herself, but also will help getting some of this extra weight off of her knees.
So how much does the skin that you take off actually weigh? Well, not as much as you may think. In a traditional tummy tuck in somebody who's had several children, we may take off a pound, maybe 2 pounds off somebody. The most I've ever taken off of one person is 25 pounds. And this was a woman who had skin that was so excessive hanging from her tummy, it literally went down below her knees. It's not super uncommon to remove 8 to 10 pounds, but this is not a situation where we routinely remove 10, 20, or 30 pounds from somebody. That really is, in general, quite uncommon.
Cornelia is going to notice a huge difference in her upper arm and upper chest and her midsection and abdomen. So no more hanging that 10 pound of skin on your body.
He cut all that skin off of her breasts and her arms, and then he brought it to her bedside to show her? That Dr. Now, man, he is one interesting character.
Next step for Cornelia will be to see if she completely recovered and set her up for second skin surgery, which will be a spiral thigh lift for her.
It is not uncommon in somebody who's lost as much weight as she has to undergo many operations. So once again, starting, let's say, with the tummy tuck, and then after that doing the breasts and the arms, and then maybe doing the thighs, and then the back. I mean, a lot of times too, you'll end up by even doing the face and neck lift as well. And this could easily get into the 3 to 4 operations. The problem is insurance usually doesn't pay for hardly any of it. Occasionally, insurance may pay for a portion of the tummy tuck, and that's usually it. So it can get really, really expensive, especially if you have a top flight plastic surgeon.
The body parts that I love most now are my legs. Before, they look like brown paper bags all crumpled up to me. I'm still healing. But now they look like smooth, firm, toned legs.
A thigh lift is a really big operation that typically has scars that go into the groin. And as you can see for her, her scars also go on the inner portion of the leg as well. Anytime you remove skin from the body, you create scars. And that's the negative when you've lost a lot of weight like this and that skin needs to be removed, is every part of skin you remove will result in a scar. And the more skin you have, the longer those scars go. Now, I am happy for her. I have seen some patients who've lost so much weight that they have skin literally hanging around their ankles. And the good news for her is even after losing as much weight as she has, that is something she does not have to deal with.
Before, my stomach was like a burrito. I love my stomach now.
So this is the most common operation performed after massive weight loss is the abdominoplasty or tummy tuck, and her tummy looks amazing. So I really give credit to Dr. Now for doing a fantastic job. When you have that much skin around it, it's really hard to get rid of the skin, especially on the sides, and he's done a fantastic job here.
When I looked in the mirror, I felt like a hideous beast. Now, when I look in the mirror, I'm in love with every single part of my body.
So this beautiful woman weighed over 500 pounds before she lost weight. But what about a woman with 600-pound legs? Yes, her legs weigh almost 600 pounds. You've got to see how Dr. Now treats these 600-pound legs because it is a fantastic sight to see. Check out this video right up here. And remember, eat real food, use clean skincare, and auto-rejuvenate before you operate.